Welcome to the Talking HealthTech podcast. My name is Peter Birch. Today I'm joined by Martyn and Kyle from Oqea, and we're going to dive into the topic of ADHD and mental health care through teamwork and innovative technology solutions. G'day, gents. How are you going?
Good.
It's great to see you there. There in your in the midst of the day today at the Oqea office, I assume. I'd love to learn a little bit more about firstly yourselves and a bit about the work that Oqea does. So, Marty, I might throw to you first.
Yeah, thanks, Peter. It's great to connect. So Oqea, we formed 5 years ago. My background's an engineer from the resource sector with a background in technology and some startups. And I was fortunate to cross paths with our founders, being our psychiatrists. And, when they shared the vision of the business and the technology, the purpose really aligned for me. I wanted a second chapter with something with real strong purpose. And here we are coming up to 5 years later, having a great time transforming mental health.
Amazing. Thanks for sharing. And Kyle, or Dr. Hoath.
Yeah, sorry, Kyle's fine. Thanks, Pete. Like Marty said, I'm a psychiatrist and starting my career in as a specialist about nearly 6 or 7 years ago now, had the realization that industry was ripe for innovation, for change, that we weren't going to have lasting impact or reach the people who needed help without some kind of change into a system that really hadn't changed with the times. We're talking not just things like AI and the tech that we deploy, but even real basic things like moving away from paper. And so it had been an opportunity we saw as a group of clinicians, and having Marty and the team on board over the last 5 years has really given us the opportunity to accelerate some of our, what we think is innovative thinking and solutions to dealing with what's really just a huge problem.
Well, Leah, look, I mean, you're not wrong. We talk a lot about on the podcast about the challenges or the burden of mental health that it has on, of course, the system, but also, all stakeholders involved, particularly patients too. You talk about innovative solutions and ways to address, this burden. Talk me through a little bit more about the things the way that you go about that. What are the solutions and things that come out of the work that you do?
So I think there's 2 parts to the problem in mental health. The first is the lack of available resources, mental health specialists, psychiatrists, psychologists. And then the other one is really there's a lot of disorganisation, a lot of systems compliance, a lot of administration to service the needs. So, I think one of the key solutions is to put some organisation into disorganisation. On the clinical side, so they're essentially doing more clinical work, which is what they're ultimately trained for. And then on the other side of the equation, we've got people, industry or society changes with social media, which is a hot topic at the moment for young kids. But there's this increasing demand for the services. Some of that is to do with psychosocial, behavioural, sort of environmental issues. So the access to services is also difficult. So there is an expectation from the consumer, and that's what our members tell us, is that they do want that face-to-face or telehealth sort of services. You can't just sort of ignore the importance of a clinician's care in someone's journey. So for us, it's about, how do we provide an efficient quality of service through a digital platform, enabling the member to connect to their care team and connect to their care team as a team, which is not very commonly done. So typically it's a lot of one-on-one conversations, and the collaboration is, I think, something that's missing, not only in the mental health sector, but more broadly.
Yeah. But what I'm hearing is that, because sometimes, for a patient going through that journey, there may be multiple clinicians or carers that they're engaging with, particularly in that area of mental health, but also, there's different preferences for the way in which they receive that care, be it online or offline in person, and in different formats. So is that the way that you're kind of looking at tackling this, is being able to offer up a solution for, geared to patients to be able to access care in a more timely way?
Yeah, we talk a lot about it as a sort of a hybrid care model, or giving patients the ability to access the right care at the right time, so when they need it. And as Marty has mentioned, we see a large part of that being about connecting the other individuals involved in somebody's wellbeing journey, or helping build out a care team so that they do have more individuals involved in that journey, whether it be psychologists, GPs, counsellors, friends, family, exercise physiologists. It doesn't have to be so unidirectional. Go see a GP, go see a specialist, start medication. There's a huge opportunity missed there to intervene in other ways and intervene earlier to try and reduce the burden, reduce people getting to the really sick point that requires hospitalisation or requires specialist involvement. So yeah, we talk a lot about that kind of hybrid model as within the team environment, and part of that is giving patients, we call them members often, choice. Telehealth, changing to telehealth from in person at the drop of a hat, and our technology allowing us to do that, so that there is no loss of clinician time or efficiency or lack of service to the member just because they had something come up at work or something come up in their family life. So that being able to sort of flexibly switch between the two has been a real game changer, and we certainly get a lot of positive feedback from our clients around that continuity of their care.
Absolutely. And who are the types of members that you're engaging with? Like, how do they come across the services you provide? You mentioned clients and members.
I think if you look at ADHD, there's an overwhelming demand for services. There is long wait times. Commonly you hear there's up to 2 years of wait time. So it's significant. It's not hard to do a bit of digital marketing, or even just you look at a typical practice, the volumes of calls that they probably receive for ADHD in a particular are pretty significant. So it's also the member, the consumer, trying to navigate their way to find those services, which is very problematic and time consuming. So yeah, there's a massive supply and demand gap, up 2 year waits. And a lot of that time is just purely getting access to sort of, paediatricians or psychiatrists who can ultimately do the prescriptions for the medication requirements. But there's a whole lot more that can be done whilst there's that wait time, and also efficiencies. A lot of psychiatrists have shut their doors because they're doing the full solution internally versus sort of working in a team environment to, share the care and provide more availability.
Yeah, got you. So yeah, right. You brought up ADHD there as like one of those common, challenges that are faced in terms of being able to access care for services often due to those long wait times. And yeah, you see, I think you touched on earlier as well, that through just the different means in which people access information these days through social media and online, that we're not short of content that's available out there. And the challenge with any platform that is very open in terms of who can put stuff out there, it means that there's no level of quality control that goes on in terms of what gets accessed. It may just be content that ranks the best on search or on current trends, and the social algorithm likes it the best, so it serves it up to more people. So I'm going to imagine if people can't access good quality care through your more traditional means of healthcare, then they're going to be turning to other sources of information. Is that right?
Absolutely. I can't imagine a world in which somebody goes down the pathway of investigating the possibility of ADHD and then does nothing for 2 years. There will be a moment of thought, there will be a moment of hyper-focus and deep dive, whether it be on TikTok or in a conversation with a friend or down a Google rabbit hole. We are unfortunately not providing the environment quick enough for people to access good quality information before good quality care. So it's a really good point, Pete, because when we talk about that hybrid level or that hybrid model of care, we see that it starts with good information. It starts with having access to resources, self-help tools, reliable, evidence-based, yet consumable information that people can turn to when they have questions, and sort of escalates from there based on the needs of the individual. But you're right, it often starts with the education piece, with the understanding, with having access to good resources in the first place.
Well, yeah, that's That's right too, and I think either yourself or Marty, touched on the fact that the time frame to not just even get an appointment, but to have a proper diagnosis so that you can get the right treatment plans or medication or whatever's required to be able to assist, particularly when it comes to ADHD. I imagine that there'd be many people who've consumed content out there in internet land that would associate themselves as a bit of a self-diagnosed person, or in inverted commas, and I guess that's in lieu of going through the quite comprehensive process of getting a proper diagnosis. I'd love to learn what that I know that a proper diagnosis takes a while for ADHD, but why does it take such a long time to get a proper diagnosis of ADHD?
In many ways, that's ubiquitous with all of mental health. We're complex beings with rich pasts and lots of things going on in our lives, both, as Marty said, psychosocially, but also sometimes biologically and factors out of our control. It's very hard in a 15, even 30-minute chat to somebody to be able to walk away with an accurate picture of their underlying mental well-being and what might be happening for them in a diagnosis space. And that extends into something like ADHD, which is complex and does overlap with other neurodiverse disorders, with other attention and sensory disorders, even with mood disorders like depression and anxiety. And so there is a bit of a work involved in making sure we're not incorrectly attributing symptoms to ADHD. And at the same time, something that Marty, as an engineer but honorary mental health clinician, will often say is that ADHD does come with a friend. We know that rates of comorbidity that's having depression or anxiety or substance use alongside ADHD, something in the order of 70+%. And so we owe it to the people who are reaching out to help to not just help with things like ADHD, but with those other comorbidities that we know are there that have a huge impact on their overall well-being. So there's a fair bit of work that goes into that. And one of the things that came out of the Senate inquiry and has been sort of prosecuted by some of our colleagues, Professor Coghill over in Melbourne, has been a focus on maintaining quality of assessment, in particular often talking about ADHD, but maintaining that quality of assessment so that we're making sure the right people get help and we're not overloading the system with those that are best helped elsewhere. And so that can't be done with these 15-minute online quick fixes. It's the online part's not the problem, though, because the online part's part of the solution. It is that thoroughness and that quality of assessment that is important, and that can absolutely be done online, but it can't be done in 15 minutes.
Oh, sorry, just to add to that, Peter. I think the reason there's this issue of quick fixes and people seeking that, and then what happens is you look at the overall cost to them around getting the wrong diagnosis. Maybe it should be anxiety treated first before, or they don't have ADHD. And so that becomes where the overall cost is ridiculously high. There's a lot of perception that to do the front end proper assessment is expensive, but when you weigh it up against a wrong diagnosis that takes 3 to 4 years to get correct, it's insignificant in the scheme of things, and prolonging the improvement in your well-being to get that right. So the quality of the process is important, and I think something that Professor Coghill has done in his research, which is so he's the international researcher in ADHD. For every 100 surveyed in pre-screeners, in some of these pre-screeners done, only 4 would be properly diagnosed, 1 would be missed, and 19 were false positives. So without that quality of screening, there's 19 people going into the system to be treated at the next level, which is cog in the system, when they actually just purely by core screening disease. There's some research on that, and that's where our driver is to use digital health and also AI as analysers and inputs to support the clinician during these workflow, so the efficiencies are there to get to the end game with quality and with increased ability to serve people.
Yeah, look, I think that That's a bit of a shocking stat, isn't it? The 19 in that particular example being misdiagnosed or false positives. Yeah, and that has a huge strain on the system on an area like if it was something a bit that wasn't as kind of prevalent, that'd be one thing. But in an area that we're seeing like mental health and ADHD that is increasing, that's a problem on a system that's already overburdened. And I think it's a great point that was brought up earlier to Kyle about the comorbidities, because you're right, it's not something that an online questionnaire necessarily that's perhaps geared and targeted specifically for one particular condition may pick up, and that's where engaging with a clinician or a trusted source can kind of help unpack that a little bit more. But you did mention that technology is part of the solution, it's not just the problem. So tell me more about the role that technology can play in assisting with all of this.
I think at the other end of timeframes, if we're just talking about assessment as an example, although I don't think it can be done in 15 minutes, I also don't think it needs 4 hours. And we see that some of the traditional methods would be, nothing for 2.5-hour appointments with a psychiatrist, or a 4-hour appointment with a psychologist, plus 3 or 4 hours of admin, plus then an hour with a psychiatrist. I mean, we're talking huge amounts of resources to arrive at a diagnosis, and those are good and thorough assessments. But there's a lot of efficiencies in there that aren't effectively, and some of that is in that admin burden of writing up and reporting what happens, and so that's one that has been one of our focuses at Oqea. But the other part is really leveraging AI and I guess the existing health information that we have, and the history and the screeners and everything that people have done coming into assessment, and not having that be wasted, but that rather having it summarized and utilized, and having patients contribute before an appointment so that the time spent in front of a clinician is meaningful, and you can achieve better outcomes and you can achieve good assessments in a shorter period of time. I think, optimistically an hour would be phenomenal, but that's certainly much less than the 6 to 8 we see occurs in some services, without compromising on quality. And I think technology is the big piece there, and some of both the assessment and both the assessment tools we've had in Oqea, but perhaps more recently, some of the AI engines and micro AI analyzers have been the real game changer for us in terms of providing some streamlined efficiencies in both components of the assessment and the distribution of that information, whether it be to a GP, back to the patient, or to the next doctor that picks up our members' care.
Yeah, I hear you on that one. I want to come back to the AI piece in a second, because there's a lot of potential there, and obviously a lot of interest in the role that can play and address some of those issues, particularly on the efficiency side. But something that came out of what you were saying too is that given that there are so many different care providers that are involved in that process, a lot of moving parts and stakeholders involved, I'm going to guess that it's not just the technology that needs to play a critical role, but those different stakeholders kind of all working together is going to be pretty important too. Sounds like teamwork's going to be a really important part of improving the model of care as well.
Yeah, absolutely. And I know we touched on that at the start, but the model in Australia of private specialists in general, and this isn't just psychiatry, really is in that kind of siloed private practice, working alone, maybe in a shared office space, but the teamwork is not something that has really developed or shone in the private health sector in Australia. Whereas I see that's a huge missed opportunity. I mean, primary care, I think, is the best example. GPs are the lifeblood and the front line and the majority of the workforce in our medical world. And yet we underutilize them in things like the diagnosis and the management of ADHD, where they are asking to be more involved. And a lot of that comes down to how can we work as a team? How can we remain on the same page? How can we communicate effectively? How can we have access to the same information? We live in a world, Pete, where we still have fax addresses as medical practices. Fax machines still exist. I don't know why. It blows my mind, Ed. I know the current Director General and a few other, I think it was Mark Butler, recently said if he could finish his term at the health minister by ending fax machines in health, he would consider it a success. There is a lot of old ways of doing things. And I know we have fire standards and other things that are trying to change that, but we have decided to tackle that head on and allow care teams to be built within Oqea with the member at the centre so that they can transition care between a psychiatrist, a psychologist, a GP, and we do that in practice with and nearly 3,000 patients of ours that are in those care teams with at least 3 different professionals from different industries, and we see not just a huge uptick in efficiencies and throughput, but actually an uptick in the quality of care they get as well. This perception that something has to be done by a psychiatrist, I frankly think is incorrect. I think something can be overseen and supported by a specialist. It is wrapped up in the term consultant. We are capable of helping and assisting our other medical colleagues in managing complex mental health presentations. And so look, I'm a huge advocate for teamwork, and we've taken that to heart in the way we've developed Oqea.
Hey, back on the AI piece for a second, because you did give us a bit of a glimpse already about the real potential that some of this has in the process of, I think, triaging or at least redirecting information to the right places. Help me understand a bit more how you see the role of AI in supporting the process for someone undergoing a diagnosis of ADHD or even for treatment as well.
I think I'm pretty good with this stuff, but I'll let Marty go because I'm still at the end of the day a psychiatrist.
Well, it's part is the teamwork of a tech team working with clinicians to validate new models of care. I think just to touch on the sort of the benefit of being in a digital space is you start to collect data, and that data drives insights to how to move forward. The legacy of working in an analog world is that there is a risk of errors in transfer of information, and doctors, clinicians all want to take, have got huge responsibility around managing patient risk. So the trust drops off pretty quickly if there's a poor information flow. So interoperability is key. And what our view is, AI should be there as a clinical assistant to maximise, organise them, given the best outcomes. And I think there's some great solutions in the market around sort of ambient listening, transcribing to notes, which is making a big efficiencies. But for us, it's around there's plenty of touch points or inputs for contributing to all those in the care team. So, for example, what's your family history? What is your background? What's got you to this point of seeking services? You can collect that and analyse it in a AI analyzer, mini analyzer as we call them, to consolidate that information. Another one is doing a bunch of pre-assessments in a way that provides the quality. So to the Professor Coggle example, the pre-assessments done in a way that are more interactive rather than the bias of a self-diagnosis strategy. So all these AI components feed into the bigger picture so that the psychologist, psychiatrist, GP can see that and use it at a later date. And the quality of the information is it's a really live digital platform, and the AI can be used with the ability of the clinician to validate or unvalidate the outcome. So it's learning along the way by the volume of the clinicians validating these inputs, and ultimately, lifting the bar in terms of quality of care.
Spot on. I think that there's so much potential there that then opens up when we can lean into some of these tools as they're emerging, and it's going to be an exciting couple of years ahead to see how they further kind of get included in that process. And it's cool that you're at the forefront of that. So that's awesome. What other to kind of round out the conversation too? Really understanding the problem and unpacking a bit more in ADHD. But I'd love to learn a bit more where your priorities are for Oqea over the next 6, 12, 24, and the types of people you're looking to get involved, because quite the unique or specific patient model of care you provide, or the service you provide to your members, I imagine in a specific geographical location, but accessible in a number of areas. But it's certainly something that has potential to grow.
Yeah, absolutely. We see this as something that's got the potential to go international around a new model of care, which is the teamwork model with great digital solutions. The success to date has been off the back of having our own, what we call our own channel partner, our own practice of teams to help build and co-design tests that each technology initiative. We've got to the point now where we're confident the data shows us where we're achieving efficiencies, we're improving the profitability of clinicians, we're improving patient outcomes. So, for 2025, we are looking to focus on scaling on the East Coast. So building some of the partnerships that we've already got established there. We've had some good partnerships in the research space from various institutes in Melbourne. So it's really starting to get that traction more broadly as a tech company to show to other practices and other clinicians there is a different way to operate. It improves your efficiencies, improves your bottom line, and with that will drive growth. And, we're sort of in the process to, we're doing a cap raise at the moment and expect to do a larger cap raise middle of next year. And that's really just about putting the foot on the gas to, get a wider audience and, help reduce these wait times, improve that quality of care.
Love it. Well, look, gents, I appreciate you making the time to have this conversation today. We'll put the details for Oqea in the show notes of this episode. And of course, you've got the listing on our website. People can learn more and click through to your website and find out details there. So, Marty, Carl, I really appreciate you making the time. Thanks so much.
Oh, yeah.